There are some workplaces where people absolutely wake up in the morning, if not eager, at least willing and ready to take the interpersonal risks of learning. I call these special workplaces ones that have psychological safety. Now, I'll define psychological safety as a belief that it's absolutely okay, in fact, it's expected, to speak up with concerns, with questions, with ideas, with mistakes. And I got into this. I got interested in this actually quite by accident. Let me tell you how it happened. I joined a team of mostly physicians and nurses, and the job of that team was to find out, to assess, they hoped conclusively, what the actual rate of medication errors was in, let's say, some modern tertiary care hospitals. So their job was to set out to collect data on drug errors, human-related drug errors. My little part was very simple. I was going to ask the question and answer the question of, do better teams, better hospital patient care teams, make fewer mistakes? I used a standard team survey measure to assess the team effectiveness, and trained nurse investigators visited a number of units in 2 hospitals every couple of days for 6 months. These were the data that they came up with. Now, these are adverse drug events, errors, just call them medication errors, that were deemed to be based on human error, expressed in terms of errors per 1,000 patient days. Now, here's where the story gets a little weird. I got the data, I waited patiently, I got the data on the teams, I got the data on the errors, and I ran my analyses. And what did I find? The results were exactly the opposite of what I had expected. It appeared that better teams were making more mistakes, not fewer. Now, from the point of view of a young researcher wanting to publish a paper, this was a real problem. Never mind the other problems, right? And so this was a problem. No, this was a puzzle. So I sat down to think, why else I thought about the need for coordination between physicians and nurses. I thought about the need for teamwork on the fly, for speaking up, for double-checking. And I thought maybe, in a kind of blinding flash of the obvious, I thought maybe the better teams aren't making more mistakes. Maybe they're more willing to discuss them. What if the better teams have a climate of openness that allows them to report and even get to the bottom of these things? Now, having that insight was a far cry from proving it. So what did I do? I sent out a young research assistant to study these units very carefully. He had to have no preconceptions. He didn't know the error rates. He didn't know how they scored on the team survey. He didn't even know my hypothesis. And I said, what do you learn? And you know what he found? He found that these units, these 8 units, were wildly different in terms of whether they were willing and able and did, in fact, talk about errors. Some of them were actually actively talking about them all the time and in the process of trying together to work together to find new ways of reducing them. I called this, much later, I called this psychological safety. Now, you might want to know, what was the sorting rule in this chart? It looked at first like I was trying to get it from highest error rate to lowest, and I just am not very good at math and got mixed up in the middle. No. These are sorted by the research assistant's ratings of the openness of the climate. As you can see, the correlation is very high indeed.